أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة المتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise is due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and it is your guidance that we seek. Ya Allah, keep us in the straight path. Ya Allah, show us the choice of blessings. Ya Allah, show us your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi, Muhammadur Rasulullah, sallallahu alayhi wasallam. It's time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Assalamu alaikum wa rahmatullahi wa barakatuh. And we welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786 Sirius FM, Radio Islam and IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion is high blood pressure, diagnosis, investigation, and treatment. And our special guest this evening is Dr. Ismail Randeree, a nephrologist practicing in America. In Umhlanga. My apologies, Doc. And practicing in Umhlanga. And we say Assalamu alaikum wa rahmatullahi wa barakatuh to Dr. Ismail Randeree.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Ismail, Jazakallah khair for joining me on the program. Yes, I don't know why I thought of America. But as our topic for discussion is high blood pressure or hypertension as we know it. Now, what is high blood pressure? How does one measure it and why is it important?
Bismillahir Rahmanir Rahim. So blood pressure, let's start off there. Blood pressure is the measure of the output of our heart. So that's now the pump and the resistance against which the heart has to pump. So in effect is a product, a calculation of the cardiac heart output against the resistance, and the output is the rate at which the heart pumps and the force, what we call the stroke volume. So that then is the blood pressure. High blood pressure then has a certain amount of values, which we will discuss in 1 or 2 minutes' time. How does one measure it? Years ago, Faisal, we had that machine called a bowmanometer. It was mercury that goes up and down as you pump the machinery. Recently, there is a machine which is automated, and that's much easier to check blood pressure. And amongst the listening audience, there are those who will be told by the doctors that, look, I'd rather get a 24-hour blood pressure monitoring device placed onto you. That will tell me what your blood pressures are during the day, at night, what your pulse is, and then we can calculate daytime, nighttime blood pressures.
Okay. So it's advanced substantially then.
Absolutely. Now, the importance, just to round up your question, the importance is high blood pressure then can translate into complications of the heart, complications of the brain, complications of the kidney, and of course, complications in the eyes. We will go into these organs, but it's important that the listener is aware that high blood pressure is often silent. That's why we call it a silent killer without any symptoms.
To remind our listeners that this is an interactive program. You have any questions on blood pressure or high blood pressure, you can forward them to us via WhatsApp on 060 904 1056. That is 060 904 1056. We have with us in the studio Dr. Ismail Randeree, and he is a nephrologist, and he will inshallah answer your questions on high blood pressure. Now, Ismail, please share with the audience some values and when is blood pressure a danger to us?
So blood pressure often is written as a value. So you have a top value, we call that systolic blood pressure, that's when the heart contracts, and a bottom value, we call that the diastolic pressure, and that's when the heart is relaxing. So in effect, the value for the top, what we learned in school was 120 systolic, the bottom is 80. So that's what we were told in school. So that's what the values refer to. The danger occurs when the blood pressure values are above 140 that's the top value systolic, or 90 bottom value diastolic. The number itself, Faisal, is not as important as whether or not that blood pressure is accompanied by complications or what we call target organ damage.
Now, talking of target organ damage, in your introduction, or rather when the first question I posed to you, you mentioned that many of the organs are involved and many of the organs get affected as well. Do you discuss some of those organs with us and the effects of high blood pressure on it?
Absolutely. So let's assume, dear listener, that the blood pressure is high, but it's not high for a minute or two. It's continuously high over a period of 24 hours, 48 hours, week, 2 weeks, 3 weeks. So as the blood pressure goes up, there is an enormous pressure on the heart as it is contracting and relaxing. So the heart muscle enlarges. When the heart muscle enlarges, we have a condition called cardiomyopathy. The vessels supplying the heart, we call it the coronary vessels, may not be able to reach all the area of the enlarged heart. So that's when you are prone to myocardial infarct or heart attacks. And then if the rhythm disturbance is changed because the electrical current in the heart is changed, then you get what we call arrhythmias or irregular heart rhythm. Hard to understand, but the higher the blood pressure, it will start affecting the vessels in the brain. As we know, the vessels in the brain are quite small, and that will then lead to stroke, a very, very nasty complication. About in Ramadan, I'm not so sure whether it was 6 weeks ago on this program, we did chronic kidney disease, and we know that high blood pressure, with the force that it goes through the renal arteries, can give you kidney damage, kidney failure, and patients with diabetes and high blood pressure end up on dialysis. The eye is the window to our heart, and often changes in the eye occur as a result of high blood pressure with protein in the urine. So that's why it becomes a danger to us.
A few questions have come in. The first question says, for runners, how high can you push your heart rate, your heartbeat?
Excellent question. I'm not sure whether you are a sprinter or whether you are a comrades runner. Always remember that the higher the heart rate, the less the blood entry into the coronary vessels. Let me explain. Allah subhanahu wa ta'ala made our heart in such an amazing fashion that the vessels around the heart, which is in the shape of the crown, the corona, the coronary vessels, they will only fill up when the heart rate is lower rather than higher. So let's say your resting pulse, dear runner, is 70. You then go up to 140. You got half the time to fill those vessels. And if you go from 140 to say 180, that's 3/4 of the time. So my answer to you is there is no fixed value. It depends on how fit you are. It depends on what your resting pulse rate is, and it depends on how quickly you increase the pulse to the level that you desire. To me, it makes no sense, and I say this openly, it makes no sense to have an increased heart rate, we call that a tachycardia, and over a period of time compromising the heart. By the way, there is an entity called the athlete's heart. It's a dilated big heart, and there are complications therefrom. I'm not discouraging athletes, but I'm explaining what happens.
Okay, this is a long distance athlete that mentioned that sent us a question. The next question says, I take my Omron 10 blood pressure monitor to doctors and specialist rooms for comparison with the doctor's BP machine, and in both the BP machine's readings are slightly high, around late 140s or 150, top reading systolic, and bottom reading 87 to 92. When I check at home, my BP is around 115 to 125 systolic, and bottom reading is 80s. Told I have labile, L-A-B-I-L-E? Labile, okay. White coat hypertension. Does labile or white coat hypertension cause vascular and end organ damage? And does it require antihypertensive medication? I am 73 years old, or simply putting it, does one treat labile hypertension?
What an excellent question. Bismillahir Rahmanir Rahim. So firstly, at the age you are in, You've taken your blood pressure machine to the doctor. Labile means that at home it was normal, yet either in the doctor's surgery, in the chemist, or when you're going to donate bloods, or anywhere outside of your home where the environment is different, your blood pressure is elevated. So in that instance, we call it white coat hypertension. We now need to advise you that it is not dangerous if we look for target organ damage. So if the doctor now looks into your eyes and it finds no evidence of hypertensive, high blood pressure, eye changes, we call it retinopathy. If your heart sounds are normal, if your ECG does not show an enlarged heart, if you got no protein in the urine, then you got no target organ damage, then it's unlikely that labile hypertension is going to cause problems for you. So it's not only the blood pressure value, Faisal. It's not only the blood pressure value. It's now a step further. You got to examine the patient, do the ECG, see if there's target organ damage before you can conclude whether in this instance the blood pressure is relevant or not. By the way, dear listener, anybody over the age of 60, elderly hypertensives, we sometimes have concurrent coexisting enlarged prostate in males, and benign prostatic hypertrophy often requires a drug called an alpha blocker. People might have heard of Uromax, Flomax in elderly. That helps with shrinking the prostate, dropping the blood pressure, so there is an additional value.
Jazakallah khair. Thank you for that, Ismail. 060-904-1056. We are discussing blood pressure and specifically high blood pressure. Now, Ismail, tell me, is there a guideline or classification for some of the issues that you've discussed?
Absolutely, yes. So now the guidelines are written by different people. So you got the American Society of Hypertension, British Hypertension Society, South African Hypertension Society, World Health Organization. They have all come together and then have classified for us that high blood pressure or blood pressure can be either normal, with the top level systolic is under 120. Then you get high blood pressure as a definition where the top level systolic is over 140. Then you have the in-between values, 120 to 139. We call that pre-hypertension. Important for the listener to understand that you don't take an isolated blood pressure reading and make a decision. So technically you should, if you're concerned about high blood pressure, take the blood pressure, call the patient a week later, 2 weeks later, take a few readings at different times and then make a decision. So the classification exists as normal, pre-hypertension, and hypertension. Hypertension itself can be mild, moderate, or severe. So moderate will be systolic 160, severe will be more than 180.
Another question comes in that some blood pressure medications cause ED, I think erectile dysfunction. Which PP meds should a hypertensive be prescribed to avoid this?
Again, a good question. Erectile dysfunction is not necessarily due to medication only. So if the listener is asking the question, ED can occur in diabetics because of what we call an autonomic neuropathy. ED can occur in patients who, with their lifestyle, increased body mass index, may have low testosterone levels. And thirdly, the medication itself. So I think one must be very cautious of the medicines. A beta blocker affects the heart, slows the heart rate, protects you from myocardial infarction, but can sometimes give you erectile dysfunction. It is reserved more for the elderly and for those who have a fast pulse. Calcium channel blockers, for example, amlodipine, they dilate the vessels, don't seem to be as much in the erectile dysfunction category, but they cause leg swelling, especially around the ankles. Then you have two types of drugs, ACE inhibitors and ARBs. They affect the kidney vessels. They protect the kidney. I don't think as a rule they will cause erectile dysfunction per se. And then you'll have a tablet called methyl dopa-aldolate, which now we are selectively using in pregnant women with hypertension. And then comes your Flomax or alpha blockers, which if anything is going to help with erectile dysfunction. So the answer to the question is often patients will associate erectile dysfunction with the medication they're taking, but you got to look at the overall picture.
Jazakallah khair. Thank you for that, Ismail. Now, can you explain the different types of hypertension?
So now you've got, as a classification, primary hypertension. We call it essential hypertension in 90 to 95% of the patients. And this hypertension, only Allah subhanahu wa ta'ala knows the exact reason for. Now, 5% is called secondary hypertension. Secondary hypertension is where you ought to look for a cause, usually in patients under age of 30 and over the age of 60, meaning if high blood pressure was first diagnosed in a under 30 patient or over 60 patient, now you say this is more than likely secondary hypertension. Is the blood pressure due to kidney disease? Is it due to vessels which are narrowed either at the kidney level, renal artery stenosis, at the level of the aorta, we call it coarctation of the aorta, or is it due to polycystic kidney disease? Sometimes you can get secondary hypertension due to what we call endocrine causes. Above the kidney, we have a gland called the adrenal gland. So there are conditions which I will mention to the audience. These are rare causes: Cushing's, Conn's, pheochromocytoma. The names don't matter. But the doctor now has to address why is this young patient or an elderly patient having high blood pressure for the first time. So that's the classification, primary versus secondary.
Jazakallah khair for that. Just to remind you that doctors and guests on the Medical Files program will help you with any medical problems you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your doctor, with your regular doctor who knows your medical history, your allergies, etc. Neither the doctors nor the relevant radio station nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on medical files. Dr. Randeree, how does the doctor approach a patient with hypertension?
Bismillah ar-Rahman ar-Rahim. So now you've established that the patient has got high blood pressure, either on serial blood pressure readings or an ambulatory blood pressure monitor. You examine the patient, you are finding some target organ damage. So the approach is, firstly, does my patient have high blood pressure? We've established that. Now we look at risk factors. Risk factors for high blood pressure are either modifiable or non-modifiable. Modifiable means high blood pressure is common in certain race groups, for example, or in men over the age of 40, or in those individuals who are taking certain types of medication that increase the blood pressure. So non-modifiable will be age, female, male, family history. Then comes the modifiable ones. So you look at the modifiable, that's my approach. Is the patient taking alcohol? Does he smoke? That's an indirect reason for high blood pressure. Is he overweight? Has he got a sedentary lifestyle? Has he got coexisting diseases, diabetes, gout, taking medication called non-steroidals? Then the third aspect to approach is, one, primary or secondary, two, risk factors. Now you look for target organ damage. You actively examine the patient, and then you have access to ECG, echocardiogram, exercise stress test, and look for protein in the urine. So it's a collective decision, not one blood pressure reading.
Jazakallah khair for that. We're going to be taking an ad break in about 20 seconds, but the question that's come through is, which we'll deal immediately after the ad break, inshallah, is, Salams, what is the position of a person, 86 years of age, suffers a stroke on the right side? We'll take the break. We'll continue on the other side of this, inshallah.
Discover our new range of exotic perfumes, ouds and bukhur, straight from Dubai, now available at Wonder Dates. We stock a wide selection of Nabil and Chris Adams fragrances, perfect for your unique lifestyle. But that's not all. We also cater to your Islamic lifestyle needs with prayer mats, tasbeehs, dua stickers, bukhur burners and mizwaks. Looking for herbal capsules and essential oils? Look no further. Experience the beauty of Wonder Dates. Shop now and elevate your senses.
The Watch Doctor. for watch repairs, watch batteries, watch straps, 21st keys, engraving, and sound for your occasion. Handled professionally at 263 Sparks Road, Mohammedia Center, Suite 104, Overport, next to the Sparks Road Masjid. Contact Zain on 082 542 3070. The Watch Doctor. The Watch Doctor. Keeping time every time.
Radio Al Ansar International, in collaboration with Radio Islam, invite you to an electrifying political debate. Join us on Wednesday, the 15th of May at 7:30 p.m. at Al Ansar Hall at 189 West Road, Overport, to hear directly from the ANC, EFF, DA, and many more as they share their vision for our future. This critical event will be moderated by Yunus Akur, CEO of Al Ansar, and Maulana Suleman Rawat of Radio Islam. This event is open to the public, so be there and make your voice heard. Because remember, every vote counts.
We'd love to meet you. Pay us a visit. Radio Al Ansar.
You listen to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Medical Files is being broadcast live on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam, and IFM, Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion is high blood pressure, and our special guest is Dr. Ismail J.S. Randeree, a nephrologist. Now, Ismail, just prior to the ad break, we had a question that came in. It says, Salams, what is the position of a person 86 years of age suffers a stroke on the right side?
Wa alaikum salam. Bismillah ar-Rahman ar-Rahim. So, in a nutshell, at age 86, we're going to have a patient who's going to be what we call atherosclerotic, meaning that the vessels will be hardened. So often they have hardened vessels in the neck called carotid artery stenosis, and they may have hardening of the arteries in the brain. So I'm not certain whether or not there is a direct relationship to high blood pressure and stroke in our 86-year-old, because that 86-year-old may have diabetes, over and above hardening of the artery. So I think we leave that question at that, because I'm not sure what they mean. What is the position?
Okay. Another question comes to says, I'm a male, 55 years old. I'm an accountant. A BMI, body mass index is 40. Blood pressure, 160/100, week 1. 164/102, week 2. 156/98, week 3. Pulse rate, 90. Do I have high blood pressure? Please, and if yes, advise on approach.
Excellent question. So here's a male, non-modifiable, age 30 to 60. His profile is that of an accountant, where I'm certain there's stress. The body mass index already tells us he's carrying more weight than he should be. When the blood pressures are looked at, clearly this patient's got high blood pressure. So the doctor will examine, look at the eye, heart sounds, do an ECG. The pulse seems to be a bit high. Yes, you do have high blood pressure, but over and above that, my approach to this 55-year-old is go to your doctor and ask, do I have diabetes? So you do the test for diabetes. Could there be coexisting thyroid disease? You do a thyroid function test. Get the ECG. The ECG will tell you whether you've got enlargement of the heart, whether you've got a strain pattern, whether the heart axis is changed to the left. All those things tell me that the approach in this individual is confirm with him that you do have high blood pressure, and discuss with him the tests that need to be done, which I mentioned. The blood test that he needs to have done in a summary form is a full blood count, in which case the hemoglobin, if it is elevated, means that he's got viscosity and thick blood. He may be a smoker, so lifestyle modification comes into play. If there's alcohol intake, lifestyle modification comes into play. Then you say to him, right, I'm going to check your either glucose tolerance test or 3-month average HbA1c. I'm going to check your thyroid function. I'm going to check your cholesterol level. Right? I'll check your prostate-specific antigen to see if you've got any prostate issues. And that's the approach. The approach is not just to take the patient, prescribe a drug and say, this is what you need to take. Because when we come to medication, now we got to decide what to give him. A beta blocker, a calcium channel blocker, an ACE inhibitor, an alpha blocker. So that's my approach to this 55-year-old.
Jazakallah khair for that. I'm on Enarapil, ENARAPIL.
Right.
Meds for my hypertension. However, I do suffer from hypoglycemia. The doctor changed my meds now because they think it could be the enalapril that caused my hypoglycemia episode. However, I've got these episodes long before I had hypertension. Is there any advice for hypoglycemia? And the question goes further. Can the meds be the cause of my hypoglycemia episode?
Again, an interesting question. Bismillah ar-Rahman ar-Rahim. So, enalapril belongs to a group of drugs called angiotensin converting enzyme inhibitors. These ACE inhibitors have been with us for over 35, 40 years. They are specifically kidney protective. The side effect profile of this is a dry, persistent cough. And sometimes if you give these medications, the effect of lowering blood pressure might be pronounced. I do not recall any association of these ACE inhibitors with hypoglycemia. For the listening audience, hypo means a low, glycemia means a low sugar level. So I'm assuming the reader, the listener is talking to us about sugars of between 3 and 5, where you have symptoms of low sugar. Also, he confirmed that the hypoglycemia occurred long before he took the enalapril, and I agree with you, sir, or ma'am, whoever has asked the question. Can you just tell me what the third part of the question was? So in other words, we've answered enalapril and the hypoglycemia.
The question was, is there any advice for hypoglycemia? And the next question is, can the meds cause more hypoglycemia?
Right. The medication, unlikely. The advice for hypoglycemia is simple. I think if you are a diabetic on lowering sugar medication, we call it oral hypoglycemic agents, then you got to adjust the dose. If you're on insulin, you adjust the dose. But if you're getting spontaneous, without any reason, hypoglycemia, the advice is simple. We have excellent endocrinologists in our midst. They will do a fasting blood sugar on you, a fasting insulin level on you, and they will do what we call a prolonged insulin level over a period of time to see whether or not your sugars are dropping due to natural release of insulin from your pancreas.
Why is it in the USA, BP over 120/80 is regarded high, and antihypertensive medication is started with blood pressure above 130/90 if lifestyle measures do not work? And in South Africa, blood pressure medication is started when BP is above 140/90. Are we not waiting too late to start treatment and higher chance of getting complications?
Faisal, excellent question. Look, I'm not particularly aware that in America there is a difference in terms of management. So I'm not sure where the listener got that information from, unless it's a medical doctor. I know for a fact that you've got normal blood pressure, less than 120/80. You've got 140/90 and above as blood pressure requiring treatment. The in-between range we call pre-hypertension. Now, that pre-hypertension, whether you're in America or in South Africa, if you are at that level and you got a high body mass index, and if you're diabetic, and you got high cholesterol, and you got a strong family history of heart disease or stroke or kidney disease, then you are right. That's when a person should be considered for treatment, because he's not only got the value, but he's also got comorbidities. He's got associated reasons to be put onto treatment. So I think the answer from my side is, it's not just the value that you need to look at for those in-between levels, but complications that are associated with it in your particular patient.
Okay, I'm not sure if the next question is related to our topic. I'm just going to pose it and you can decide, doctor, whether you want to answer it or not. Salams. What is the role of nitric oxide in the body, and can one get it over the counter, or would one need a prescription?
This is beyond my capacity, to be quite honest. I don't know whether nitric oxide has any relationship to hypertension and its value, so I'm afraid I won't be able to answer that.
Okay, so are there any symptoms that can forearm or can forewarn us of hypertension?
Bismillah ar-Rahman ar-Rahim. So earlier on I mentioned that often hypertension is called the silent killer. That's because they may have no symptoms at all. Now I'm going to group a few symptoms that will occur in patients with high blood pressure. But if you have those symptoms, dear listener, it doesn't mean you necessarily are in danger. So if, for example, a person suddenly gets a severe headache, has blurred vision, is feeling very dizzy, and has an opportunity to have home blood pressure testing, that blood pressure, for example, is 180 above top level, 120 and above bottom level, that is what we call a hypertensive emergency. Similarly, if that blood pressure occurs in somebody who says, look, I'm getting this chest pain, it's almost like a truck driving through my chest, I'm short of breath, I'm not breathing with ease, possibility of swelling of the legs over a period of few days, that's also a hypertensive emergency. And the third one is where over a period of time, patients notice that they have nosebleeds, which they can't explain, unexplained palpitations, or anxiety attacks. So those are the different ways in which the presentation may occur.
Okay. Female, 50 years old, postmenopausal for the last 5 years, on hormone replacement therapy, getting a recent onset of headaches, leg swelling, the blood pressure is like 146/94, 140/90, 150/100, pulse rate is 70. Now, how does one deal with this patient? What's the position, though?
Again, an excellent question. So now you've got a change from the male was 55 to a female. This lady tells us that she's postmenopausal. So some of these symptoms may be due to the postmenopausal causation. However, she's also telling you she's on hormone replacement therapy. And we know that hormone replacement therapy in her or in the young female who's on oral contraceptives, that high blood pressure can coexist. So we've got that one cleared out. Now, when the person's got recent onset headaches, just for the listener's sake, headaches can be due to multifactorial reasons. Right? You can get sinus headaches, migraine headaches, headaches due to cervical neck muscle spasm, high blood pressure. So there are many causes of headaches. But when you now look at this patient, the headaches are recent, the legs are starting to swell. Now you've got to be careful. Now you're asking yourself, don't only look at the blood pressure. Is this patient now in a menopausal stage and now going either into complications of the heart? That's why she's got leg swelling. Causes of leg swelling can be heart failure, kidney damage, low thyroid function, hypothyroidism, low albumin or liver disease, nephrotic syndrome where you have excess protein released from the kidney. So there are a lot of causes of leg swelling, but one of the causes of leg swelling can be the postmenopausal state. So the approach to this patient is not only to look at the blood pressure, but to identify whether or not she's getting complications related to the heart or she's got a risk of getting a stroke, or there is now, with the leg swelling, damage to the kidney. So this is the sort of patient where you can't walk into a family practitioner's room. The family practitioner writes out a script, reassures the patient, this patient needs investigation.
Now that you mentioned family practitioner, who determines whether you've got high blood pressure? Is it the GP or is it the specialist that determines it? At what stage?
In my humble opinion, the general practitioner is the best person because that patient often goes to a particular practitioner. The practitioner knows about the patient, about the family dynamics, about the lifestyle, and the family practitioner then has a responsibility to measure the blood pressures over a period of 3 to 4 weeks, do the ECG, do the basic bloods, check the urine, and then say to the patient that, look, I think you've got high blood pressure. The problem, Faizal, is often the patient has no symptoms. And now you give medication to the patient, and that's when they have problems.
Jazakallah khair for that. We'll visit the marketplace. We'll continue on the other side of this, inshallah.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickville Road, Overport. Simplex Radio, the name you can trust.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness. And every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and Freezer card calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
Radio Al Ansar, 24/7, 365.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Our topic for discussion is high blood pressure, and our special guest is Dr. Ismail G.H. Randeree, a nephrologist practicing in Umhlanga. And Ismail, just to continue with, just to remind our listeners that you can send us your questions via WhatsApp on 060 904 1056. That's 060 904 1056. Ismail, just another situation. There's a male who's 24 years old. He goes for an insurance medical and they find that he's got protein in his urine. Blood pressure 160/100. What is the approach? How does one deal with it?
Bismillah ar-Rahman ar-Rahim. So now, early on in this discussion, we mentioned that high blood pressure can be primary or secondary. We said that secondary high blood pressure, often we have to look for a cause in those that are diagnosed under the age of 30 or for the first time over the age of 60. So here's a 24-year-old male. So already now we have a high index of suspicion. We are now going to look carefully into his history. He goes for a routine insurance medical. He could very well have gone to blood bank to donate blood, or he could have gone to a local pharmacy. The moment there is protein in the urine of a male patient or blood in the urine of a male patient, alarm bells must ring. That means there's something happening. This blood pressure is either affecting the kidney, or the patient has got kidney damage to start off with, unbeknown to him, and therefore now he's got raised blood pressure. So the approach here is not for the general practitioner. Early on, I said the general practitioner has an important role. Here, the general practitioner has to now step aside. The general practitioner now has to advise this patient. Firstly, is there a family history of kidney disease? Is there a family history of high blood pressure, diabetes, cholesterol, heart disease? Is he an athlete? Is he on anabolic steroids? Is he taking creatine? All these things. Is there a history of smoking and alcohol and substance abuse? So this is the sort of patient where we can miss through the system unless the doctor is acutely aware that this individual needs to be investigated. And I think this is an excellent question that we have been asked. And if you remember, we spoke of chronic kidney disease. This is the sort of patient that at age 40 to 50 can end up on a dialysis machine.
Okay. Let's talk about the different types of medication that's involved in hypertension.
So we have what we call classes of drugs. So the one class of drug which is acting against the receptors in the heart, we call them the beta blockers. Beta blockers not only drop the blood pressure, they also drop the pulse rate. And remember, we started off this discussion, blood pressure is cardiac output multiplied by the resistance against which the blood is being forced. And output is heart rate multiplied by the force, stroke volume. So the beta blocker protects the heart, slows the pulse. Then you have something that dilates the vessels. We call them the calcium channel blockers. They are excellent in elderly people and in the black population. The beta blocker, very effective in those patients who have a high degree of anxiety with high blood pressure. Then the drugs that we mentioned that are nephro or kidney protective, ACE inhibitors and angiotensin receptor blockers. Now you got an elderly patient, enlarged prostate, high blood pressure, we use alpha blockers, Uromax, Flomax, doxazosin. Pregnancy, we use Aldomet. So these are the classes of drugs that we have available. Lots of drugs available, enough opportunity to use the right ones. Regrettably, patients may have side effects. You got to navigate through that challenge.
Assalamu alaikum. A question for the doctor. Please, does pressure medication such as Perienda cause frequent urination?
Okay. Perienda itself is, in my opinion, if I'm correct, a angiotensin converting enzyme inhibitor. The one that causes excess urination is Perienda Plus. The plus component has a water pill or a diuretic. So Perienda per se shouldn't cause you to pass more urine. But if you got Perienda Plus, the plus, so for example, some people will have Loza Plus. The plus is the diuretic, the water component. Perienda itself, to my understanding, is a plain ACE inhibitor.
And another question comes in, also medicine related. Specialist prescribed me Cosa 100 mg. Will it cause ED?
Unlikely. The Cosa belongs to a class of drugs called angiotensin receptor blockers. They are kidney protective. They decrease the pressure as the blood flows into the kidney and within the kidney itself. I think that per se, and I'm open to correction, if you look at the package insert, Faizal, it is imperative that every symptom that the patient has is recorded. So they will be in the package insert, perhaps ED as a potential side effect. The question is what percentage of the patients will have. So for example, if you are on Aldomet, drowsiness, high percentage. Erectile dysfunction, high percentage. Postural blood pressure changes, high percentage. Yes, but Cosa, if the listener has got coexisting kidney disease, very good drug, very safe drug, and very effective drug.
Assalamu alaikum. Is it true that if your diastole bottom reading is lower, it is actually better?
What a lovely question. Okay, so there was a time when a lot of emphasis was put onto the systolic blood pressure. The higher the top level, the greater the risk of complications. The diastolic blood pressure is actually when the heart relaxes. So let's visualize it. When the heart contracts and forces blood out, that's the top level. Now the heart has to relax, right? So when it relaxes, that's the bottom. The question that you've posed is interesting. Remind me what it is that he wanted to know specifically, or she wanted to know specifically.
Is it true that if your diastole is lower, it is actually better?
Well, years ago, there was a theory and they called it the J curve. There are certain patients in whom if you drop your lower value, your diastolic blood pressure too much, you may precipitate angina. These are the cardiac patients. So I suppose in theory, if you have a low blood pressure, diastolic, you should be cardioprotective and better, but not in those individuals who need that little bit of pressure if they have coexisting heart disease. That is the J-curve hypothesis. And in those instances, if you speak to a cardiologist, for example, they'll tell you it's not necessarily lower the better. It may in fact be detrimental to go too low diastolic.
What is the reading for high cholesterol?
What is the reading?
Reading for high cholesterol.
Okay, interesting. If you look at the labs, remember you got different types of labs. I'm not going to mention them on air. The upper limit for most of them is 5 millimoles per liter, the upper limit.
Assalamu alaikum wa rahmatullahi wa barakatuh. Faizal, my name is Mahmoud Ahmed. I have a question for doctor. I'm 58 years old. I'm experiencing pain below the navel, going down to the groin, heavy swelling. It's swelling and heavy pain. What is causing this problem for me? I do smoke cigarettes and my pressure is low. Please, okay, I'm hearing you. Wonderful show.
Bismillah ar-Rahman ar-Rahim. Jazakallah for the compliment. I think important for me to advise this patient that firstly, you are a smoker. If you look at the dangers of smoking, most of us were told in medical school that dangers of smoking included lung disease, secondary impact on heart disease, but there is also an impact on the bladder. Between the navel and the pelvis, you've got the bladder sitting there. If it's a male who's asking that question, then please go and do an ultrasound of the abdomen. Include in your request, or the doctor must include in the request, ultrasound abdomen with pelvis, and make sure that whoever's doing the ultrasound does it pre and post water intake. And they must have a very careful look at your bladder, at your kidney, and if it's a female, of course, your uterus, etc. I think that the swelling in the groin and the pain could be related to an organ in that area, and what lies in that area for a female will be bladder and uterus and ovary, and for a male will be your urogenital system.
Okay, we've got like 2 minutes. Before I ask you for your final message, I just want you to touch on diet and types of foods that affect our blood pressure.
Again, a very good question, very important question. Let's try and summarize. If we want a lifestyle modification, in terms of diet, bad for us will be obviously not permitted alcohol, but salty foods, red meats, which impacts on the kidney, too much of sugary foods, saturated fats. So those are harmful. By the same token, there are certain foods that are useful, fruits, vegetables, nuts, and lentils. So that, in a summary, is what lifestyle modification is. Lose some weight, do some exercise, and take it from there.
Thank you so much, Dr. Ismail Kulamus and Randeree, thank you for joining me on the program. But of course, I need your message to our listeners, please.
Bismillah ar-Rahman ar-Rahim. The message is simple. High blood pressure can be a silent killer. You are not going to be able to think and say that you've got high blood pressure unless you do an actual measurement. The measurement must be done in an effective manner. There are certain rules and regulations applying to that. Please, if you've got a family history of high blood pressure, heart disease, kidney disease, cholesterol, diabetes, go to your friendly pharmacy, have a 3-in-1 check. This weekend, check the glucometer for sugar, check the blood pressure, check the cholesterol. If you're lucky, they can check your urine, and then make a way to the practitioner and decide whether you got a problem. That's my message for high blood pressure.
For one of the listeners, the message comes, Shukran, Jazakallah khair. May Allah subhanahu wa ta'ala reward you and the doctor. Keep up the good work. Ameen. Jazakallah khair. Shukran for that message.
Jazakallah.
Dr. Ismail Randeree, shukran and Jazakallah khair for joining me in the program this evening. And I want to thank all the engineers at the various radio stations for having engineered this evening. And I want to thank the listeners for tuning to Medical Files. Medical Files will be back with you. Next Tuesday evening, inshallah, at 8 p.m. And till then, for myself, Faizal MJ Suleman, it's Assalamu alaikum wa rahmatullahi wa barakatuh.
An informative Islamic global perspective. This is Al Ansar